Have you or a friend or a family member suffered from an autoimmune disorder? If so, you've probably been led to believe that this is a lifelong condition and it's impossible to turn around. You've likely been told that you'll have to take the medications for the rest of your life with no relief in sight. The fearful reality also exists that once you've developed one autoimmune condition, you're far more likely to develop another one or even multiple conditions. Why is this? Is it possible to reverse this deteriorating process? Is it possible that your body has the mechanisms within itself to reverse disease and heal? In this eye-opening series, we'll be exploring these concepts. You'll have the opportunity to hear multiple testimonies from autoimmune patients who have reversed their autoimmune conditions and are living happy, healthy lives. Today, we will begin by exploring what autoimmune conditions really are and what causes them to occur. You've likely been told that there's no way to know what causes these conditions, and while there may be various factors, we'll see that really it comes down to some very core processes in our body that we need to understand. Understanding how our bodies work and how disease develops can have a profound positive effect on the rest of our lives. Okay, I'm here with Dr. Davidson and we're going to discuss some really interesting factors when it comes to autoimmune disease, what its true causes are, what its true solutions are. Pharmaceutical drugs are not the solution, then what is?
Yeah, well, I just think about my wife's journey. When she was 7 years old and she started having symptoms and getting sick, and the doctors didn't know what was going on, and they gave her some medication to cause brain encephalitis, and then she went into a coma for 6 weeks, and they ended up finding out that she had Lyme disease. And then as soon as they found out she had Lyme disease, and this is almost 30 years ago now, but when she found out she had Lyme disease, they gave her antibiotics, IV PICC line antibiotics for about a year, and then oral antibiotics for another year. And I just look at, if that was the answer for her in that case, because oftentimes chronic Lyme will be in the autoimmune category as well. But if that was the answer for her, she wouldn't have had a need for heart surgery. She wouldn't have had a need for sinus scraping. She wouldn't have had to, remove herself from entering the Junior Olympics for swimming because of her health issues. All these different things triggered from that. And I always just see that being a Band-Aid, just trying to cover up symptoms. And research has actually shown, Jonathan, that vaccines can trigger autoimmunity and actually will, like different autoimmune conditions. So that's when you look at the pharmaceutical industry, it's often looked at of just the prescription pill side, but the vaccine or vaccination side is almost a bigger money maker for them. And it's really scary what's happening with the laws where there's actually not the choice to choose whether you want to or not, and it's always up to everybody's own opinion in that category. But when you actually look at the pharmaceutical industry, it's this huge umbrella. It is multi-trillion dollar, businesses and Fortune, like 50 companies, they're up there. So there's always profit, there's always motives, really behind that. When you're looking at solution, you always want to look at the cause, so in order to identify, okay, what do I need to do to get my body well, you have to identify what actually triggered it in the first place. And the big four things that I see from a practitioner side of things, Lyme disease and co-infections, which it's in the pathogen category. You've got mold, and mold is a very major issue household. If there's ever been water damage in your house, if you ever feel better when you're outside of your house, sick building syndrome, a lot of the work environments actually have mold to them. So we've got Lyme and co-infections being a big trigger, mold being a big trigger, heavy metal toxicity, and you could say toxins in general, but there's such a big modern day epidemic of heavy metal toxicity that's happening right now. And also we know mercury directly provokes autoimmunity in people, demyelinase the sheath, which is basically like MS, multiple sclerosis. And then the fourth thing I would throw into that category is parasites. And in that, there's controversial treatments in the holistic world for parasites and for gut issues, which we can get into. But it's really these four things that if you have any of these going on, they're going to negatively affect the digestive tract. They're negatively going to negatively affect the thyroid, the adrenals. They're going to negatively impact the things that are what I consider downstream. So oftentimes, even in the functional medicine world, we'll go through an adrenal protocol or we'll go through a thyroid protocol, to try to help support that organ. The question always to ask is, what is the source of that? And if we can identify what that is and then remove it, now all of a sudden everything that's downstream can start getting better. And from an autoimmune standpoint, Dr. Alessio Fasano, 2009, actually wrote an article in the Townsend Letter on this. And he basically said that there are, when you're looking at autoimmunity, you can consider it a three-legged stool. So if you imagine a stool with three legs on it, if you take any leg out of a three-legged stool, what happens to the stool? It tips over. And what he's saying is you imagine autoimmune on top. And as soon as you pull a leg out, that stool tips. Now you've triggered autoimmunity. And when you look at the three legs, he says one of them is environmental triggers, or really what we'd consider like the stressor category. Another one is genes or genetics, which I would also say the genetic expression in that. And then the third leg by itself is actually leaky gut. And from a science standpoint, for any researcher, listening to this right now, if you're a researcher, you get a little like, well, is leaky gut even a real thing? Well, when you actually go onto PubMed and type in leaky gut, you're gonna find all kinds of stuff. Now, 5-10 years ago, not so much, but it did exist, but it used the name intestinal permeability. So intestinal permeability just means that essentially, that there's essentially the junctions in your gut are open bigger than they should be, letting things in that shouldn't be. And when you let things in, like big undenatured proteins or any type of food, any type of pathogen, let it in, now the body's going to start attacking it, and that's usually where autoimmunity starts getting triggered. So the gut, for sure, super important, leaky gut, but it's usually a downstream issue, like mold, parasites, heavy metal toxicity, Lyme and its co-infections are usually upstream of what causes downstream issues like gut issues. And we can't forget about the mental, mind, emotional stressors, but that's another piece to the puzzle too.
Dr. J, so you're talking about 4 key areas for somebody to assess. Now, whether somebody has arthritis, rheumatoid arthritis, whether somebody has lupus, whether somebody has Hashimoto's thyroiditis, you're saying that regardless of which of the 80 plus autoimmune diseases you have, these are the 4 steps you need to assess in every one of those cases. And if you can understand this, if you can correct this, then you can expect great results. Is that true?
Yes. Yeah, if you can identify what the underlying source or sources to your health issues, our bodies were made to heal. If you can remove the source, you can absolutely get well. The body was designed to heal. As long as we can figure out what's interfering with the ability for the body to function, remove that, the body can absolutely get well, for sure. What is an autoimmune condition? You hear about lupus, you hear about rheumatoid arthritis, you hear about you hear about MS, multiple sclerosis, and a lot of gut issues like ulcerative colitis, Crohn's, fall into this autoimmune category. But when you actually start looking through science, more and more conditions and diseases are actually getting thrown into this. So now we have well over 200 different conditions that are now being classified as autoimmune in nature. Things like autism, things like type 2 diabetes, always been known for type 1 diabetes to be autoimmune, but now they're classifying type 2 as in that category. Cancer, these are huge diseases and huge conditions that are now being thrown into the autoimmune pot. So when we actually look at autoimmune, it's almost scary to think where it's moving toward, Yeah, when I look at what's the strength of the classic treatment for autoimmune conditions, I don't see anything on that list. So I'm pretty much, from a practitioner standpoint, clinically, it's what is natural, what is more of actually going to the source, and that's really the key. Because when you boil it down, autoimmune means that there's an imbalance in the immune system. It's often referred to that it's your body attacking itself, which is correct. And it's all involves the immune system. So of course, when you look at autoimmune, there's immune in the word, right? Immune system, the one primary goal for the immune system, and this is all that it does, is it kills stuff. It kills pathogens, it kills bacteria, it kills viruses, it kills parasites, and that's its job. Right now, we're dealing with an onslaught of chemical toxicity, which is starting to trigger autoimmunity that our bodies were never meant for, and it gets us into a bad place. But backing up and looking at the immune system, we've essentially got two arms of the immune system. We've got the Th1 and we've got the Th2. Within each arm of the immune system, there's a bunch of different like chemokines and cytokines and things, but essentially you can boil it down to we have two basic arms of the immune system. And technically there's more to it, but this is a really easy understanding. So we've got Th1 and Th2. When you have an infection, like let's say you get a flu virus, you catch it from somebody, the Th1 immune system is going to fire. It is the fast acting. And think of these as they're both, military, right? We've got the Navy and we've got the Army. So they're both military, but they work a little differently. So we've got Th1 that comes in, it tags things, and then Th2 is that immune system that then comes in later, more longer term. So when we have autoimmunity, essentially what's happening is we get stuck. We get dominant Th2 or we get stuck and we get dominant Th1. So the immune system is firing one way or it's firing the other way. And this is really more of the scientific approach and the understanding of autoimmunity. And so much of what's happening right now in our society with Th1 and Th2 becoming imbalanced is this toxicity epidemic. So let's say that you get exposed to mercury toxins, and those mercury toxins attach to your thyroid, which then can trigger something called Hashimoto's, which is an autoimmune thyroid condition. It was actually it was the first autoimmune condition ever classified as autoimmune in nature. It was like the early 1900s. And so mercury on the thyroid, now the immune system says, wait a minute, that's not right. I'm gonna go after it. Well, can our immune system kill mercury? No, it can't. Mercury cannot be killed because it's an element of the periodic table. It's not actually living like a virus, bacteria, or parasite. So what happens is then the immune system, when it's going after mercury, it's actually damaging tissue around it. When it's damaging tissue around it, now it's actually decreasing the function of the thyroid, and now all of a sudden you start having hypothyroid, and you need to take Synthroid, or you need to take some type of thyroid to give the body some boosting. And the goal isn't that you need that to help with the body's help with the body. Inevitably, that's just treating the symptoms. So we have to identify, okay, why is the body actually attacking the immune system, or the thyroid cells? Why is it attacking it, and how do we shut that off? And basically what happens is this Th1, Th2 just becomes tipped one way, or it becomes tipped the other way. And autoimmune in nature, we're looking at big diseases like cancer. So cancer essentially is when it becomes Th2 dominant. When you're looking at lupus, rheumatoid arthritis, MS, even chronic Lyme disease, that's typically more Th1 dominant. So we get stuck, and that's really autoimmune. Is we just think of it like a teeter-totter, a balance. When it gets pushed one way versus the other too far, that's when autoimmune gets triggered. So if we can do things that actually help to balance this out, and there are some tests that can help detect Th1, Th2 balance. There's also, you can always look at using energetic testing, like muscle testing, or different electrodermal screening to try to detect it. But then there's also this whole category to say, okay, let's say we're autoimmune. We have Th1 dominance, we have Th2 decreased, or we're the opposite. What can we do? There's some things, what they call immune modulators, that actually help balance this out no matter what direction you are. Things like vitamin D3. I mean, how many times do you hear about vitamin D3? And it's technically a hormone. We know scientifically it affects out of the 25,000 genes we have, human, it affects about 3,000 of those genes epigenetically, positive expression. So vitamin D3, super important for the body, but that immune modulates, so no matter what side you're tipped on, vitamin D will help with that. Colostrum actually helps modulate the immune system, Th1, Th2. Vitamin A, vitamin E, glutathione actually, superoxide dismutase. So there's actually many beneficial things that can help to help balance the autoimmunity of it. Now these things I don't think are the end-all solution. I think there's more steps, and we have to really peel the layers back to really find out the causes, but they can also help kind of calm down those autoimmune reactions, autoimmune storms that people get into.
Essentially, these autoimmune disorders are all manifestations of your immune system malfunctioning and appearing as various symptoms at different times. The names given to these different diseases are simply classifications of symptoms themselves rather than a true diagnosis of what causes the disease and how to treat it. Thus, at times, depending on the medical professional who is doing the diagnosing, one person may be diagnosed with different conditions depending on the current symptoms they are manifesting. Dr. Davidson, when it comes to the industry, the healthcare industry, pharmaceutical drugs, pharmaceutical companies, now, is this problem with autoimmune disease the fact that, from what you're saying, a lot of the drugs are not working, a lot of the drugs are not effective, a lot of the drugs are causing problems, and we can talk more about that later. But what's the problem here? Is it simply because there's a lack of information, or they're just not up to date with what might be working for certain people that we're coming in contact with, they're getting remarkable results, or is there something else at stake here?
It's a great question. Really, the answer is follow the money. Money is power, and right now, you're asking about corruption, and it's like there's so many different levels of corruption, unfortunately, that are happening. I mean, you can go back to the early 1900s, I believe, when Rockefeller basically donated a ton of money to medical schools, but in agreement they wanted to influence the curriculum. And that's really when everything started shifting from what we know that's naturally made, that's effective to help people, to now it's, synthetic, pharmaceutical, petroleum-based type, chemicals and ingredients and things which by law are the only things that they can say cure anything, but in reality it's probably the only thing that actually won't ever cure anything. So when you look at corruption, it goes deep. It goes to who's learning the information from the pharmaceutical industry, which is pretty much the modern doctor right now. And the whole system is set up for that. I mean, when I look at corruption, Jonathan, when I look at it, one of the areas that really, I get emotional and I get upset is what's happening with kids nowadays from the birth process, like pregnant moms. So pregnant mom gets a RhoGAM shot, which has the highest amount of mercury of any vaccine before a baby's born. Babies aren't, the child in the womb isn't getting to determine, hey, I'm ready to come out. It's a doctor or somebody else setting that date for them. So, okay, your pregnancy will fall on this date, because we don't want you to go too long. God forbid, we'll let the baby decide when it's ready to come out. So we're going to puncture the amniotic sac. Oh wait, things aren't picking up, so we're going to give the mom Pitocin, which then puts the baby into fetal stress, which they know that does that. That's why they do a fetal monitor. And then that leads to more interventions such as drugs and then possibly even C-section. And it's that medical intervention that then starts racking up bills, and then the hospital system can actually make a lot of money that way. And the rabbit hole goes deep. So even if somebody does a natural birth, for instance, oftentimes they'll put mom on her back. And this doesn't happen all the time, but this is the standard. And the goal is that you or your loved ones don't become the standard, right? We step out of this horribly put together medical standard box and actually look at how are our bodies designed. But they'll put mom on her back trying to push in labor, which is one of the hardest positions to actually push a child out, like reverse gravity up over the tailbone to get a child out. Let's say the child comes out. There's usually 5, 6 foreign people that are catching the baby, clipping the umbilical cord right away before the baby's taken its last nutrients and oxygen and blood from the umbilical cord. You always want to wait till that stops, then you can clamp it, then cut it. But it really should be dad catching. It should be baby going right on the chest of mom, because baby's got all this sensory on the head, on the body. And what do we do in the medical world? Some foreign person catches the baby to bond with the baby that I'll never see again, immediately wraps it up, cleans it up, puts a hat on, and then puts it off to the side, or if it does give it to mom, then the baby's sitting on mom, but the baby's got all the sensory covered up. And then all of a sudden, then a lack of bonding actually happens. between mom and the baby. And it's all these traumas that I believe actually increase the risk of a child developing a type of condition like autism, developing autoimmunity. I mean, research shows that if mom gets a bladder or a urinary infection while pregnant, the increased risk of autoimmunity for that child increases like 40%. Autism actually increases. You know, if mom has celiac disease, which is an autoimmune, you know, basically disease of the gut, you know, reacting to gluten, the child is highly more likely to have autoimmune conditions like autism. So all these different traumas play such a big role, and I believe that right there, I mean, you're asking about conspiracy, and you said conspiracy is really, what was your definition?
Secret organized crime.
Yeah, secret organized crime. Like I believe that they reverse engineered the birth process and said, okay, how can I cause the most harm to a child and mom, and let's do that. And then now we're gonna have patients for life that we can enter into this system that we're gonna give drugs to that are never ever gonna treat the underlying cause, but we'll just try to manage symptoms, but keep them in the system, because they make money when you're sick. And our bodies were designed to be well, but we just have to figure out what were our, you know, what's gonna support that process.
Hi, I'm Rachel Carnuth, and my daughter, when she was 9 years old, was diagnosed with an autoimmune disorder called juvenile dermatomyositis, which was skin rashes on her face, on her legs. She had arthritis in her hands and arthritis in her knees, and we were able to find a holistic doctor to help us and get us on this road to recovery.
In my hands I had arthritis, and I could feel like at school I stopped doing the monkey bars because my hands hurt. I could only close my hands like this much, but now I can close them all the way. My skin rashes were on my eyelids and my cheeks, and a little on my neck and on my leg.
Wow.
And you had arthritis in your knees that was diagnosed that you didn't know about, and your hips. At one point, when we didn't realize what was going on with her, she was sick. We were living overseas, and she had this terrible stomach pain and was so weak after being sick that she couldn't even jump up one flight of stairs, like one little step. But now we laugh because she could jump like 3. So she had a lot of muscle weakness too, associated with her autoimmune disorder that she eventually got diagnosed with.
So Celia was, one of my patients. She'd been, little girl, she was diagnosed with a disease called juvenile dermatomyositis, which is basically, it's a skin and a muscle inflammation. So it manifests with rashes. It manifests with a lot of pain. Now, this little girl was a gymnast, and she couldn't get on the bar. It hurt too bad. So, one of the things we did with her is, of course, autoimmune disease, you've got to look for, 4 triggers, the 4 big common denominator triggers. So for her, she was gluten sensitive, and it was very obvious, but we tested her genetically to confirm it. She was also allergic to things like tapioca and squash and mango, like foods, real foods, whole foods, right? So, go figure, you don't change those things, the problems don't go away. So you've got to get the diet cleaned up even more than just going gluten-free, going beyond that, right? And then she had several deficiencies, several nutritional deficiencies that we had to get corrected as well. And so within about 4 months, it didn't take very long. I mean, we went from, first meeting her to getting her diet identified where she needed to be, to her following that. And then just within about 4 months, she's able to get back up on the bar. She's able to do gymnastics again. The skin rash is going away, and it's almost gone at 4 months. At 5 months, the skin rash is gone.
How does that make you feel as a mother?
Amazing. Amazing. I mean, it was the hardest journey ever, but God brought us through it and led us on certain paths, and one of those was Dr. Osborne, and it's amazing to look back and know that she's completely healed through all her hard work, and it's a lot of cooking and shopping involved, but she's done it. I mean, she's had to change her diet, and she's had to take supplements and learn how to do all that. And it was a slow process, but looking back now, my husband and I just like, wow, because it's been a little over a year since we saw Dr. Osborne, and she's amazing.
So the autoimmune industry is a massive industry, and even by standard medical definition, it's about $100 billion industry just for medical treatment. But when you actually look at what are the major diseases in our country that are happening, diabetes, cancer, brain, cognition, dementia, heart disease, so many of these diseases are actually autoimmune in nature. So we could almost make more of a blanket statement and say that autoimmune is such a massive piece to this disease epidemic that's happening in our country. So 100 billion, I think, is very conservative. But when you look actually through the research, they're tagging more and more conditions. They're tagging them as being autoimmune in nature. Well, so your comment, Jonathan, that whether it's intentional or unintentional, it's like you're too good of a person. Like it is intentional, and you can see this in so many different aspects of the mainstream medical world. I mean, they are literally systematically trying to abolish homeopathy. They're literally trying to remove that as a treatment. And this has happened, acupuncture, chiropractic. I mean, there's been agendas in the medical world to systematically try to remove anything that competes to the pharmaceutical agenda into the pharmaceutical, treatment realm. Because anything that's natural that doesn't fit into that, they don't profit, so they want to remove it. And it's a scary time right now, knowing that with their agenda, it's just going to keep going, and it really does need to be a revolution needs to happen. I mean, people need to stand up and say, for crying out loud, we need to make a change. Like the direction we're moving in, when you look at autism, and it was 1 in 10,000 kids in 1980, maybe 1970, and then in 2013, the CDC said 1 in 50 kids are autistic right now, or on the autistic spectrum. And then you have researchers prominent from MIT, Dr. Stephanie Seneff, saying in 2032, right now, the way the trends are going, it's going to be 1 in 2 kids are going to be autistic. I mean, at what point do we have to stand up and say, enough of this, and we need to figure out what can we do to support the body naturally? And unfortunately right now, there are doctors, natural doctors, and people, advocates in the autism world, in the cancer world, that are looking for alternative treatments, and they're coming up mysteriously dead. We're looking at maybe 80, 90, even 100 doctors or researchers in this natural alternative world realm looking for answers outside the pharmaceutical have come up dead in the last couple of years. I mean, how scary is that? I mean, I go to bed and I am on alert because this is a time and place where we need to make a change. And if we continue down the path, it is scary of what's going to continue to happen with our health and our family and our children.
The medical community has developed into a system of finding a way to spend the least amount of time with a patient while deriving the most amount of money from the encounter. Unfortunately, our medical system is a business, and like any business, it needs to make money. Every time a medication is changed or a procedure ordered, the doctor or medical institution receive financial bonuses, especially if this can be done in less than 15 minutes spent with a patient. Do you see the problem with this system? Are the patient's needs truly being understood and explored? Does the doctor have true incentive to find out what is the true cause of a patient's illness? To sit down with the patient and go through the blood work, explore possible areas of concern? To talk about the ways to prevent disease? Does the doctor benefit if the patient develops more diseases?
A few facts about autoimmunity is that 50% of healthcare costs, this is from a commercial-based insurance plan, 50% of healthcare costs are attributed to 5% of the patients. That's a scary fact. That means that half of your insurance premiums that y'all are all paying right now are paying for 5% of the people, not yourself. Why is that? Because the drugs are ridiculously expensive that we're using to treat these diseases. So what are some autoimmune diseases? Hashimoto's, lupus, psoriasis, Crohn's, rheumatoid, multiple sclerosis, diabetes type 1. There's a ton of them out there. And generally, if you have a weird medical condition that nobody can explain, it's probably an autoimmune condition. So what are some other autoimmune disorders that we consider autoimmune? We consider asthma, eczema, nasal allergies, any kind of allergic component is on the autoimmune spectrum. It's not really autoimmunity, but it goes away with some of the same things we do with autoimmune, so we kind of lump it in there. And then, is autoimmunity inherited? Oftentimes people will say, well, my mom had Hashimoto's, so that's why I have Hashimoto's. So Hashimoto's or autoimmunity in general, you can be predisposed to, but just because your parents have it doesn't mean that you're going to have it. It is reversible. We've seen it. We've got patients to prove it. Y'all have probably seen or heard of people that have reversed it. And so if you have a propensity towards autoimmunity, you can protect yourself from it by taking some of the same measures before you develop it. So this, if you take home anything from this lecture, it's actually this tree. Because all of us are a tree, and we have our roots, which is our gut. Our gut takes all our nutrients and rain and sunlight and all that and makes it all into energy, right? There's no other energy source besides what you put in your mouth. So our root system is our guts, and everything that you see above is our systems, our symptoms, systems, whatever you want to look at it. So let's call one of those branches is autoimmunity. So say you start developing symptoms, one of those branches is an autoimmunity. And then we want to get a little more specific and say, well, that specific branch is Hashimoto's, because the symptoms that go along with that are brain fog, fatigue, joint pain, and you have some Hashimoto's antibodies. Well, that's important, but we don't want to stare at the fruit too long because that's not the root of the problem, right? If you've got a dead branch of a tree, are you going to go looking at the leaves and say, well, clearly the leaves are defective because they're dead? No, you're going to go look at the branch, then you're going to look further down, you look at the roots, wonder why isn't it growing, right? So that's one branch, but what about the other branch up there? 30% of people who have one autoimmune condition develop a second and even multiple others. So while you may have an autoimmune condition that may not be that severe, you might develop a second one that is more severe. So I say that, and I don't want to scare people, but if you have Hashimoto's disease, your risk of developing a second autoimmune condition, which might be diabetes type 1 or multiple sclerosis, those are really potentially life-changing. Yes, Hashimoto's and brain fog stinks, but not being able to see from multiple sclerosis is a lot worse, right? And so the things I'm hinting at with those other apples are paralysis, blindness, numbness. Those are signs of multiple sclerosis. So if you look at the conventional medical model, they're going to give you a drug for every symptom out there and try to fix those problems. But we don't want to focus there at all. We want to focus down at the roots. And the two biggest things that you want to take away from this lecture is if you want to reverse autoimmunity or protect yourself from autoimmunity, then you need to make sure these two broad categories are great. Your gut is your number one life support. If your gut is not healthy, if you don't have the right balance of bacteria, yeast, digestive properties, then you are predisposed to really anything, but especially autoimmunity.
There's a powerful tool set that's valuable to all people. Whatever condition I have as I'm watching this series, every single piece of information is going to be valuable to me. What would you like to say in regards to that?
It's a great point when we're looking at a label. So I feel like from a clinical side, and I'm working with a client, it's easy to get caught into, I want a certain diagnosis. I'm just looking like, what do I have, right? Oh, I've got MS, or I've been diagnosed with lupus, or I've been diagnosed with rheumatoid arthritis. And then it's like all of a sudden it stops from there. Like all I wanted was a name. And I would say, let's remove the label, because inevitably it still is not telling us what's the source of it. Like why did MS or RA or lupus show up when you're 35 years old and you didn't have it when you were younger? It's obviously not genes, it's something got triggered, something's a source of it. So let's just try to put the label to the side and boil down and try to figure out, okay, what are the underlying issues in my body and how can I remedy them? When you're looking at autoimmunity, Sjogren's, Tourette syndrome, lupus, RA, multiple sclerosis, fibromyalgia, chronic fatigue, like any of these diagnoses, from a clinical standpoint, I always want to rule Lyme disease out. Now, am I saying that if you've been diagnosed with any of the ones I just, mentioned, you have Lyme disease? No. But so oftentimes, Lyme disease is known as the great mimicker. And if we just say, oh, I've got RA, and we stop trying to figure out, well, what triggered that? Why do I even have it? If that is a correct diagnosis, then we stop looking at the source, where it could be a bacteria like Lyme disease that actually triggers this, or mercury toxicity, right? You get a filling drilled out, the mercury exposure sets the body over, and all of a sudden you're developed MS and you're not sure how that happened. We don't want to just settle for a label. We always want to look at the source. We want to find the source and correct that.
Autoimmune disorders are one of the most misunderstood conditions in medicine, in my opinion. Most of medicine is operating off of an old paradigm, an old thought process where they are operating under the assumption that the immune system in an autoimmune disorder is actually an overactive immune system. An immune system is overaggressive and overactive and over-vigilant, if you will. And the truth of the matter is that's not the case. The truth of the matter is that a person dealing with an autoimmune disorder has a dysfunctional immune system. They have an immune system that has lost its ability to differentiate between who's good and who's bad. And because of that, the immune system may be attacking different tissues in their body, different types of hormones or different aspects of different organs, or so on and so forth. The thing is, the immune system is not overactive. The immune system is misguided and has lost its ability to tell what's me and what's not me. Okay? I'll give you an example. There was a heavyweight boxer some years ago. His last name there was a chicken company with the same names. This particular boxer was ferocious. He was, they would unleash this fella in the ring. He'd come across the ring swinging, and he didn't quit swinging until the other boxer was done. He was amazing boxer. And so I want to use this analogy. Okay, we have a boxer that is the heavyweight champion of the world. We have another boxer that's his opponent. Okay, but let's say the heavyweight champion has a cold. Okay, and he doesn't feel well. He goes to the ring and he has a round with this other fella that's also a professional boxer. Okay, this other professional boxer just has his way with him for the first round. Okay, the first round, the champion gets beat up a little bit, right? Well, let's say we go into round two, and not only is the champion beat up a little bit, but we blindfold him. Okay, he comes into round two blindfolded, so he can't see his opponent. He knows there is an opponent there, but we also put both cornermen, all the judges, and all these other people, we just let everybody into the ring. Okay, so now the ring's full of people, and we have the heavyweight champion of the world's best boxer, against the contender, who's the next best boxer in the world. Okay, they both know each other's there. Heavyweight champion goes out into the ring, but he's blindfolded. Okay, he's blindfolded, he can't see. So he can't tell who's his opponent and who's not. Okay, how do we determine who he's going to knock out first? Is he going to knock out his opponent, or is he going to knock out one of the judges, the referee, or okay? What we don't know is who he's going to knock out at all. All right, he may knock out everyone. He might not knock out anyone. Okay, I'm giving you this picture because this is what's happening in an autoimmune disorder. Your immune system is the world's heavyweight champion. Okay, if your immune system gets beat up a little bit, okay, it doesn't have the right nutrition, it's been exposed to toxicity, okay, different toxins and things in the environment, and it's had to deal with different stresses, your immune system gets beat up a little bit, all right? If it loses its ability to differentiate, it gets blindfolded. Okay, so now we have the world's heavyweight champion going about trying to take out an opponent, but he's blindfolded. Okay, and he can't see, can't differentiate. Okay, and that is what's going on in an autoimmune disorder. Now, what we need to understand is, how does that come about? How does that happen? How does the immune system become dysfunctional and lose its ability to differentiate between who is my body and who isn't my body, who's my friend and who's my foe. Okay, this is what happens in autoimmune disorders. The immune system can't tell. It can't tell who's good, who's bad. It knows that there's something out there that it needs to go after, but it can't tell who's the good guys and who's the bad guys, so it goes after everything.
Autoimmune conditions include a host of symptoms such as joint swelling and pain. Therefore, rheumatoid arthritis and similar joint conditions also fall into the autoimmune category. When these are ignored, they can advance and turn into more serious autoimmune disorders. It's important that we're able to catch these conditions at their start if possible, so that the healing process will likely be more rapid. The longer the conditions are left to linger, the longer they may take to reverse.
As hard as I work out, you would expect normal, aches and pains and things. I'm 54 years old, and so probably more aches and pains than a 20-year-old guy after working out. But I started having like kind of recurring hip problems, like it just hurt a lot. And so I was going to a practitioner for deep tissue and myofascial release and all that, and they could help me a little bit, but he was concerned because it would come back so quickly. And so they did an x-ray, the x-ray results came back, and it just wasn't all that conclusive. He was kind of like, this is not something you need a hip replacement for at this point, at least not from the x-ray report, but it's something you need to probably just kind of manage the pain through foam rolling and massage and doing different things. And so I happened to be at Dripping Springs Pharmacy, and I was inquiring about some supplements or something, and I mentioned something about joints. I can't remember. One of the ladies at the pharmacy said, there's a functional medicine doctor right in that office right there. He's here like a couple days a week. And I'm like, I had never heard of functional medicine. And so, and I'm a functional fitness guy, so I thought it kind of, the terminology kind of piqued my interest. And so she gave me a little card of his. And on it talked about stem cell therapy for joints without surgery, and about supplementation and all that in a holistic way. And so I called and made an appointment, and I went in and talked to Dr. Oob, and the engineer side of me, I like data and I like information, and so I would ask questions and he would just fill me with data, and it was just like, all right, I gotta go look this up. And come to find out, he said, yeah, we can do stem cell therapy. He looked at my x-ray report and decided that, it didn't look like anything that required like major invasive like hip replacement or anything. But he said, before we talk about stem cell, I want to make sure you're healthy. And he said, you look healthy, you're a fitness trainer and all this stuff. And he ran a very, very extensive blood test that came back pretty negative. It was, he emailed it to me late at night, and then he said, I don't usually do this, but he goes, it's kind of ugly, in terms of you're a fitness trainer. He goes, I don't know what you eat. I don't know, what your diet is like, but he goes, we got to talk, because you're pre-diabetic. You have, you're on the brink of a full autoimmune blowout. And there's a lot of, lipid profile was off the charts. I mean, no B12, I had no omega-3 fatty acids. And he's like, all right, so we went and we reviewed the report. And I had to admit that at some point, I know about nutrition from my training, but I was more of a do as I say, not as I do kind of trainer, unfortunately, at that time. I thought, hey, I work out 3-4 days a week. I look good, so therefore I must be okay. And what he showed me on the blood results was that I was really not okay. But yeah, from November through June, I was hardcore paleo. No dairy, no bread products whatsoever, no legumes, very strict paleo. But the blood numbers showed, and that was the coolest thing I think about eating healthy like that is, I know that when I first started researching all this, and Dr. Barry Sears came up with a zone diet. I don't know if you've ever heard of the zone, but basically it's an anti-inflammatory diet. Lots of omega-3, fish oil. You take that and you stay away from all processed sugars to keep your insulin levels kind of in a medium zone area. And by doing that, you reduce inflammation in your arterial walls. Therefore, you can actually reverse like atherosclerosis and some of these conditions where your heart's pumping through clogged veins and all that. You can actually fix all that by just eating right. And through, discussions with Dr. Oob and the information that he's given me and the books that I've read now, it's like you can also reverse autoimmune conditions strictly from the way you eat. In fact, one of the books that I read said that like 65% of autoimmune conditions is diet, not genetics. So you can be completely predisposed to, genetically to an autoimmune condition, and it doesn't mean that your genes have to express that condition if you eat right. And that to me was like that was my light bulb, bright light moment, is that I was really literally eating myself to death, or to a very miserable, environment of autoimmune stuff.
So this is Steve's actual blood levels. When he first came to see me, he actually came to see me for hip pain. Actually, he referred someone else to me before he came to see me for stem cell therapy. So he came to see me for a hip pain that he thought he was going to get stem cell therapy for, that we were going to help him regenerate his hip. And I said, wait, Steve, let's do some labs before we do that. He didn't know that he had rheumatoid arthritis. So we diagnosed Steve with rheumatoid arthritis, and he's been having this hip pain and migratory joint pain for years. So after, I think this is about 6 months, I didn't write it down, about 6 months, his rheumatoid factor dropped by 4, from 22 down to 18. Now that may not seem like a really big drop, but if he drops by 4 one more time, he's normal. He is technically normal, and he has reversed rheumatoid arthritis. This is a debilitating arthritic condition. I don't know how many of you people know or have seen anyone with rheumatoid arthritis. It is disturbing what they look like in their 70s and 80s. Their hands are just riddled with arthritis. Their fingers point the wrong way. It's horrible. And to think that this can be changed by removing gluten and dairy and sealing leaky gut instead of Humira is incredible. And Steve did it. So he also had lupus. He was on the lupus spectrum. So if anyone knows what this test is, it's called an ANA test with a reflex. The ANA test is a way to throw out a broad net and catch as many fish as you can in the autoimmunity sea. And then when you drag that net up, you see if you've caught any fish. If you catch any fish, you're listed as positive. Done. You caught a fish, an autoimmune problem. Then they try to identify as many of those fish as they can. And so they run 10 or 12 of the individual test and say, well, we didn't identify in the fish, but he's got some sort of fish in there that we don't know what it is. Steve was not that way. He flagged positive for 3 different fish in his autoimmune soup. And then 6 months later, completely negative. So this is what I was talking about with the shorter you have an autoimmune condition, the easier it is to reverse. So Steve's lupus was likely a lot younger, and his rheumatoid factors, rheumatoid arthritis, has likely been going on for years to decades, and that's why it's going to be a little more stubborn. Yes, Christy?
I have to add that this patient was extremely dedicated to the changes he was making.
Yeah.
Almost unrealistically so, as looking at it as somebody who's also deals with lupus spectrum. I couldn't imagine, I saw his devotion to those changes, and that's why he saw those results so fast. So not everybody's going to be able to make those changes like he did. He was just completely, his mindset, he's a CrossFit trainer. And so the time and efforts that he spent in it was extraordinary. It was above. And so it can happen, but just know that he really strived to make those changes, and it was absolute dedication on his end.
Dedication and commitment are really a plus when fighting autoimmune disorders with functional medicine. You can't just do it halfway and expect to see results. The more committed you are, the more determined your efforts, the more positive your mindset, the better your body will respond to the protocols.
The sad reality, though, is as a fitness professional, as I've kind of told people about this, I've come to realize that there's a very small segment of society that will take the words and go, I'm going to do what you did, Steve, and I'm going to eat right for the next month. 30 days is really all it takes to reverse a lot of these conditions. They just won't do it. Because there's pills they can take, like prednisone or other anti-inflammatory drugs that will help you get rid of the symptoms, but you haven't actually solved any of the underlying problems. But
what proportion of people have you found that will say yes and those that say no?
Out of the people that I've spoken to, probably 70% won't do it, and only about 30% will actually take a proactive approach to eating right. And because the issue is, it's not, you can't just eat right a little. You got to go all in or nothing. And that's because, like, it's not about, you know, removing gluten most of the time. If that ends up being the thing that ruined your small intestine, is the gluten problem, then you can't just eat a little gluten, because the problem's still there. And like Dr. Ebe explained to me, and now that I've read, is like, if your immune system starts to fire off on gluten because it recognizes gluten for some reason as an invading body, it has a long memory. And so you can't just get off gluten for a couple of weeks and go, I'm good. Because even if your gut starts to heal, your gluten sensitivity, your antibodies are there, and your body remembers that. And so you got to go all in.
So when you look at one of the root causes of autoimmune disease, which is inflammation, essentially anything that causes an inflammatory response in the body can trigger autoimmune disease. And this list is yay long. Top of the list, toxic thoughts, toxic foods, toxic pharmaceuticals. Virtually every pharmaceutical you're going to take is going to have an inflammatory response on the body. It is absolutely mind-boggling to realize that the products that we put on our skin and our hair, that we brush our teeth with, all this stuff is laden with chemicals, and to whatever level, whether minor or extreme, it will cause an inflammatory response.
So we have leaky gut. Okay, we have fatty liver. We have these are two particular organic issues that lead to autoimmune disorders. Okay, and they do this, one, leaky gut, undigested food floating into the bloodstream, causing an irritation and an inflammatory immune response, which eventually leaves the body in an inflamed state, number one, but leaves the immune system exhausted. Okay, so the immune system, because of if we're eating 3 times a day and the immune system has a inflammatory response every time we eat, it wears out the immune system. It gets to where the immune system gets to where it's exhausted. Okay, and so it gets tired of having this level 5 alarm 3 times a day, okay? And that exhausts the immune system. As the immune system gets exhausted, it starts to it starts to dysfunction, okay? It has a faulty function then. And that's where autoimmune disorders start to happen. The other thing is the liver that is not filtering properly, okay? Whether due to toxicity or nutritional deficiency or both at the same time, the liver is not filtering properly all these toxins that we're exposed to every day, which there's 80,000 known toxins that we are exposed to on a daily basis just in our homes. Okay? It's a massive number, okay? If the liver is not filtering all these toxins out properly, it starts to store them. When the storage bin is full, guess where they go? They don't get stored in the liver. They permeate and get stored, well, they get shoved out into the rest of the body, which causes another source of irritation, which causes an inflammatory response from the immune system, which further exhausts the immune system. Okay, so I hope I'm painting a picture here that you can understand that if you are suffering from an autoimmune disorder, it's not because you have an overactive immune system. It's because you have an exhausted immune system. An exhausted immune system loses the ability to differentiate. Okay, it's kind of like the blindfolded boxer. Remember we talked about the heavyweight champion, okay? He goes out there. Well, if he goes out there blindfolded, he's super powerful. Okay, he can go out and knock out anybody. But if he's blindfolded, he can't tell who he's going to knock out. It may be the person that he's supposed to knock out, it may be the referee. Okay, if he's blindfolded, how is he supposed to tell? How is he supposed to differentiate, right? And so an exhausted immune system is in that same position. It's blindfolded, and it can't differentiate between what's a pathogen or a toxin and what's my liver or my shoulder or my thyroid or my brain, okay? That's what happens with an exhausted immune system. So to take a step back, this is my explanation to explain what's actually happening physiologically in a autoimmune disorder.
So prevalent, and they're lucky because they know that they had it, whereas all these women that don't know they have it,
or denied that that's the reason for their symptoms.
Yeah.
Right.
And yeah, these poor women, particularly, obviously being around 10 to 1 women to men, and these poor women that get so often told that they're just, it's in their head.
They're depressed. Actually, so that was another piece of the story I didn't tell. So when I first got my results, my primary care person was out because she had broken her ankle, and I had seen the results the day before because I was in for a routine annual, and I just happened to see them in the computer kiosk. And I saw the antibodies, and I knew what that meant, and my TSH was elevated, and I went in for my results, and there was a physician who was substituting for my primary care person, and the first thing he said was I think I said something like, I saw that my TSH is elevated, and I have antibodies, and that makes sense, because I'd been experiencing any number of symptoms, including the cold intolerance too, and other stuff, and he said, "How do you know you're not just depressed?" And I wanted to throw the chair at him because it was such a cliche. And I just said, because I wasn't depressed 2 weeks ago or 3 weeks ago, and I have nothing to be depressed about. And I just got up and left and waited for my primary care to say yep, this is what it is, and here you go, here's your prescription. And then I started the discovery process after that.
Wow, good for you.
But that's what happens, right? When any number of patients, and especially women, are said, it's in your head, it's not that, you're just lazy, or you need to sleep more, or the classic, you're a tired mom because you've got small kids, and I see these patients too, and I'm like, no, it's not all in your head, and it doesn't have to be this hard, right? They're struggling through their life and their day because they have a hormonal imbalance that's making everything a lot harder.
Wow. You're an MD.
DO.
You're a doctor of osteopathy. I remember looking at that and going, oh, cool, same like Joe Nicola. Yeah, you're a doctor of osteopathy, and so you understand the modern medical system as well as more innovative, natural-based approaches, holistic medicine. So what do you see as being the major flaws within the modern medical system? How is it affecting people's lives for the negative?
So I refer to conventional medicine often as cookbook medicine because it's almost like there's a recipe for every diagnosis. There's a set of symptoms. These sets of symptoms, if they check mark the boxes for this diagnosis equal this diagnosis, and then here's the standard of care treatment. End of story. And for a couple of things like acute infection and trauma, Western conventional medicine is super helpful, and we need it for those things. But when it comes to chronic disease, the problem with symptoms, diagnosis, treatment is that very, very little of the time is there ever a question of why? Why are these symptoms being created? Okay, we can label it and the label just allows for ease of conversation, but it's very reductionistic. And it doesn't give people any insight or options or avenues for making themselves well, which I think is almost like a birthright. Our bodies are self-healing, and so it doesn't honor that. It doesn't allow for that truth to be available to people.
Did you know that if you're symptom-free, you may still be in the process of developing an autoimmune condition? By having the proper test done, you can determine if you're at risk for developing an autoimmune disorder, and you can take the steps that you need toward prevention. If it is possible to prevent yourself from developing difficult health challenges down the road, would you want to take the best steps possible to be in your optimum health?
Well, really the truth is that it most likely is happening to you right now. And it's a scary statement to say, right? Because it to some degree, it's a little more fear-based, right? Like, oh my gosh, but autoimmune in nature is slow developing. And oftentimes symptoms don't show up right away. Symptoms are years later. When you start looking back and it's like, gosh, when did this actually happen? This was probably 10, 20 years ago in development. And when I look at our culture right now, I see a massive epidemic of digestive gut issues. And one of the primary gateways to trigger autoimmune is having gut issues. So if you have any type of digestive symptom, I mean, you want to say, okay, this is opening me up to possibly even trigger an autoimmune in my body. So fixing the gut, making sure the gut is healthy is really a critical thing, but it's quite daunting actually when you think about how many people probably do have autoimmune right now. Yeah, I mean, when I look at what's the strength of the classic treatment for autoimmune conditions, I don't see anything on that list. So I'm pretty much, from a practitioner standpoint, clinically, it's what is natural, what is more of actually going to the source, and that's really the key. Because when you boil it down, autoimmune means that there's an imbalance in the immune system. You know, it's often referred to that it's your body attacking itself, which is correct. And it's all involves the immune system. So of course, when you look at autoimmune, there's immune in the word, right? Immune system, the one primary goal for the immune system, and this is all that it does, is it kills stuff. It kills pathogens, it kills bacteria, it kills viruses, it kills parasites, and that's its job. Right now, we're dealing with an onslaught of chemical toxicity, which is starting to trigger autoimmunity that our bodies were never meant for, and it gets us into a bad place. So fixing the gut, making sure the gut is healthy is really a critical thing, but it's quite daunting actually when you think about how many people probably do have autoimmune right now.
So I see a lot of immune dysregulation. Autoimmune disease is historically thought to be incurable, and most people come in with a particular diagnosis. So we can talk about like Crohn's or ulcerative colitis or neuromuscular diseases like MS, and they are on a trajectory where they have to, maybe take multiple medications to try to manage the progression and or the symptoms. And yet, even with that, oftentimes, they either become symptomatic again or, they break through the symptom control and they come looking for a new answer. And it's not uncommon. It ranges from just dietary and lifestyle changes being 100% turnaround, no medications needed, completely asymptomatic for indefinitely, to there needing to be more disease reversal work, like putting together the stepping stones that led to this signaling to go awry, and reverse engineering that so that people can get back to a place where their bodies become self-healing and they're able to find a place back to optimal health. And I definitely see that with pretty much every autoimmune disease across the board. Antibody, evidence goes away completely. So even from an objective data point, it's gone. And subjectively, they are not needing medications. They, a lot of people actually lose weight in the process too, even when they're not trying, because of the reasons that they're holding on to things to begin with. All of their systems start working better. So, the hormonal system is actually one that is a later downstream impact point from some of these more root cause issues, like whether it's immune dysregulation or these inflammatory processes. So they get their, balanced hormonal signaling back, their mood changes, because a lot of autoimmune diseases come with, suppressed mood. And I would say over 90%, maybe even more than that, have complete reversal of their disease process and their symptoms and are asymptomatic, not on medications. And it's remarkable, and yet even though it happens over and over again, it's still this thing that's surprising every time, because they actually have to do a lot of work to get there. At the same time, like, we have a roadmap. I think the main message is that if you keep your buffer resilient and your ability to navigate the influences and the ups and downs and the exposures of life, if you choose wisely and you keep that buffer in place, you don't actually ever have to get sick, and you don't even really have to engage this concept of aging or age-related diseases. And it doesn't mean like you can't have fun, but there should be that as highlight points of your life rather than the thing that runs your whole life. And so if you're able to make as many choices as you can that keeps that resiliency intact, you're good, and you can actually enjoy things along the way without succumbing to some sort of disease process or level of unwellness. We're not born with that. We're not born to break down and to get sick.
Perhaps you've been in a situation where you've had symptoms that you can't explain, that even the doctors can't seem to explain. Perhaps you've had to have multiple tests done only to find out that they're inconclusive. But don't give up hope. A functional medicine doctor may have the tools that you need to finally be able to understand your puzzling health problems, to help you come up with an ideal plan to heal your body and prevent further conditions from developing.
To be honest, I don't know if I want to continue because of the resistance. Like, there's that point, and I feel like probably even the listener right now, with whatever health struggle, autoimmune, you're dealing with, or even family member, where you get to a point where you're like, is it even worth it to keep going? And it always comes back to, what's your why? Like, what drives you? And I will tell you that I have a 5.5-year-old daughter that was a blessing, and it really forced us to do things and help my wife that we wouldn't have if she didn't come along. But I look at, where we're going to be in 20, 30, 40 years, and if I have the opportunity to change it, I'm going to, because I want a better future for my daughter. And it's that mentality that's going to allow us to change the culture in the health world, but it's also going to allow you to move forward and get well health-wise, because there's always dips. We always think it's like this, Jonathan, we think it's like this linear climb, right? Like, oh, I've figured out what I have. Now I'm going to start, removing the sources and fixing and really working on my body. I'm going to start going like this. It's like this. Like, there's days where you don't feel well, and it is what it is. But you got to keep your eye on the bigger picture, because that's the direction you're going in. Don't focus so much on how you're feeling today if it's not good. Think about the big picture. Obviously, we want to live in the moment, but it's really that I hope I can give some hope to the listener to know, what? There is hope. And even if we're up against a wall, I'm going to fight even harder, because that's just my nature. There's a time where I'm like, is it worth it? And then I'm like, but what else would I do? Like, I'm put on this earth for this, to help with this.
This first episode has really been about helping you learn what's going on inside your body when you have an autoimmune disorder. We have explored ways that you can prevent autoimmune disease and have seen that it's possible to turn it around. Don't give up hope on your health. Stay with us in coming episodes to find out in more detail how various autoimmune disorders can be reversed. You'll have this incredible opportunity to hear amazing transformation stories from those who've overcome dementia, Lyme disease, adrenal fatigue, and thyroid disease. You won't want to miss out on this life-saving health information.